At some point, everyone experiences a strange symptom and wonders, is this serious? Or should I go to the doctor right now, or wait a bit? This doubt is completely normal, but knowing how to tell the difference can make a huge impact on your health. In today's video, I am going to explain how to identify the signs that truly require medical attention, and when it's safe to monitor things at home without panicking. Understanding this is important because our bodies don't always give clear signals when something is wrong. Sometimes we ignore a symptom thinking it will disappear on its own, and we end up delaying an important diagnosis. In other situations, we rush to the emergency room for something that could have been observed calmly. Learning to interpret your symptoms helps you avoid serious complications. Stop self-medicating incorrectly, get faster treatment, and feel more confident taking care of your health. There are some symptoms you should never ignore. If you experience chest pain or shortness of breath, seek help immediately, because this can be a sign of a heart attack or another serious cardiac or pulmonary condition. Sudden confusion or loss of consciousness is also an emergency. It may indicate a stroke or another neurological issue. A high, prolonged fever, especially above 102 degrees Fahrenheit 39 degrees Celsius for more than 48 hours, should always be checked by a doctor. Unusual bleeding, like blood in the urine, stool, or vomit, must be evaluated right away. The same goes for severe abdominal pain, especially on the lower right side, which can signal appendicitis. And if you're having trouble urinating or passing stool, that can also be a sign of something serious. But not every symptom requires an urgent trip to the hospital. Some mild issues can be safely monitored at home for a few days. A mild headache, a sore throat without a high fever, manageable menstrual cramps, or cold symptoms that are gradually improving are examples of situations where observation is totally fine. Just remember, if things get worse or new symptoms appear, then it's time to seek medical attention. Whenever you're unsure, there are a few simple questions that can help you decide. Did the symptoms start suddenly or get worse quickly? Is there a high fever involved? Is it affecting your daily routine or your ability to function normally? Have you tried home care without any improvement? If you answered yes to any of these, the safest option is to reach out to a healthcare professional. Even outside of emergencies, there are times when seeing a specialist is a smart choice. If your symptoms keep coming back, if there's discomfort with no clear cause, or if you need a proper diagnosis to start treatment, don't hesitate to consult a doctor. And if you're not sure which specialist to see, start with a general practitioner. They'll guide you and refer you to the right expert if needed. Another important point, try not to rely on online searches to diagnose yourself. It's tempting to type your symptoms into Google, but that often leads to unnecessary fear or incorrect assumptions. When in doubt, always talk to a real healthcare professional. And today, with online consultations available, getting medical help has become much easier and more accessible. And of course, the best strategy is always prevention. Regular checkups, balanced eating, physical activity, good sleep, and stress control make a huge difference in keeping your health on track and avoiding future problems.